So what I'm going to do now is to ask two very important people to come up to the microphone, and we're going to ask them a few questions about why they've become involved in this enterprise, and I hope that you'll enjoy meeting them. They're very special individuals, and one of them is the person who the Cancer Centre is named after, Naloon. Patrick, come up. Naloon. And Alan Gillam, who are together co-founders of the Naloon Foundation, which I'm going to ask them to tell you a little bit about. So, what is the Naloon Foundation? Naloon.
Firstly, the reason that I'm here and I've started the Naloon Foundation is because of wonderful professors and doctors and carers like Robin Ward. I met Robin back at St. Vincent's 13 years ago when I was diagnosed as a cancer patient. And the Naloon Foundation is all about caring for patients with dignity and helping them to go through their journey in the best possible way, receiving the best care. And most of all, what we like to do is have people treated equally, irrespective of their social or financial circumstances. So our foundation is mainly a fundraising foundation that helps patients to fight cancer with dignity.
Thank you, Naloon. And can you tell us about some of the things that the Naloon Foundation has done over those 13 years, because there have been some pretty remarkable contributions to cancer care. So either Naloon or Anna.
Thank you. Firstly, Robin, thank you very much for having us here today. It's truly inspirational to see the work that's occurring in this campus, and truly inspirational to see how great minds and great people and dedicated professionals have come together to create something really great. And Robin, thank you. Thank you for making that happen. Naloon and I started the foundation simply to try and provide some support to underprivileged patients, or patients that potentially didn't have, as Naloon said, either the financial or social means to get them through their cancer journey. And we didn't really think that we would make a significant difference. We were just trying to do small things that might have been significant to individuals. Over the last nearly 14 years, we've raised close to $18 million. That money has gone across a range of different services, and it really started off at first providing psychological support for cancer patients. So we funded, in the early days, clinical psychologists that were attached to the oncology units in order for patients to have great social support at that very traumatic time in their life. From there, we kept fundraising, and we identified that more and more hospitals required that support. From there, we were approached by a number of different hospitals seeking our support for other types of services, and they were everything from brain tumour nurses, breast care nurses, etc. And from there, we went on to provide support to Garvan and St Vincent's Hospital to help them build their new cancer clinic there, and to establish the Naloon Cancer Centre as the outpatient and treatment care for the patients of St Vincent's Hospital. Throughout that journey, we obviously kept very close with Professor Ward, and she came to us and she expressed her vision, which was to create something really special and meaningful here on this campus, and to ensure that patients had good quality and equality of care. And I mean, how could you say no to her? And that's why we're here.
So many people in the room say no to me all the time. You can get to John Roberts. Now, you've committed to raise $5 million, which is an extraordinary amount of money, and it's basically the dynamic duo of you two that do that. I think a lot of people in the room would not have really an idea of what it takes to raise that amount of money. So perhaps you could tell us a little bit about how you feel taking on the idea that you're raising $5 million and how you do that.
Yes. What's most remarkable is that Anna and I both have day jobs. Anna works for tourism, and I work for a telco company, so that's our day paid jobs. So the foundation is our passion, and I think our friends are a bit tired of the amount of money we've asked them, and they walked away with their pockets inside out. But the way we've raised this money is by community engagement, by trying to get people like you to go and talk about what we do, and by raising money through fundraising activities. We have trivia nights, swims in the coldest month of the year, which is July, and a big signature event, which is our Black Tie Ball. And we ask the community to go out and help fundraise and do their own fundraising for us as well. And then, of course, we have asked a few of the major corporations in Sydney to help us. But because we are such a small organisation and one with a very difficult name to spell and pronounce, that's sometimes it helps. So most of it has been through word of mouth and asking people to help share our vision.
Thanks, Ngaloon. And is there a way in which the people standing here can help?
Yes, by spreading the word, please, and in any way possible. It doesn't have to be thousands or millions of dollars, but every cent that you raise and is given to us goes to patient care, because we are run completely on a voluntary basis, so we don't have any overheads at all. So that's a really good thing.
So thank you, Ngaloon and Anna, for coming today, and also for your unwavering support to the project over a period of time now, which seems interminable for us living through it, but I know it's coming to fruition. So thank you very much, and thanks for coming today.
Thank you.